of you around when I have to meet my day. I don't want a long funeral. Tell them not to mention that I have a Nobel Peace Prize. That isn't important. I'd like somebody to mention that day that Martin Luther King Jr. tried to give his life serving others.
The Farm to Health Center initiative, we started it as a way to create an intervention for food insecure patients at the Family Health Center. There's a really large population of patients who need food, and we know from other research that physicians often don't ask or don't know where to refer patients to. We wanted to create a program here at the health center that physicians could know about and directly refer patients to. We originally thought it was going to take us 4 hours to distribute 1,200 pounds of food each week, and we've been doing between 8 and 1,200 pounds of food, depending on the vegetables, within the first hour.
It's been helping. It's been helping my family a lot.
Because of this program, I've been able to have more fresh food at the table every day.
What we do are preventive medical and dental services.
Now, big deep breaths through your mouth.
All of our services are free to patients who come in, and that in itself reduces a lot of worry about what will I be charged, what bill will I get.
Chin up for me.
I think we all love our jobs, which is really one of the beauties of this, is that it does give me a sense of how strong people have to be.
The Hector Reyes House is a substance abuse treatment facility for Latino men. While they're here, they have primary care, infectious disease, psychiatry, licensed clinicians who take care of them along with addiction counselors. So they're here up from 6 months to 1 year. After being here, they graduate to the house next door, which is our transition house, and they're able to stay there up to 1 to 2 years. While they're there, we just opened up Cafe Reyes, which is a training facility / restaurant for the guys to train and to get jobs.
I was addicted to heroin and addicted to the lifestyle of the streets. This place changed my life totally. I am the program director now, and what better could I say than that?
It's about health equity and social justice. Vulnerable people needing different ways of addressing a problem so that they can get better.
It's the best thing I've ever done. It's incredibly rewarding, and I've always worked in the community and done lots of work in the community, but to see people's lives change is amazing to see, and that is what happens here.
We've been working in Liberia over the past 7 years now. After the Civil War, there were only about 170 physicians in country, and not all of them were practicing medicine. There were no pediatricians on the ground at all to take care of children in Liberia, and that's how I got involved, to come over and help train doctors to take care of children. The resources are extremely limited there. It's understandable how an epidemic like this could really take hold in this country.
The needs are huge. The outbreak is just overwhelming, the capacity of these countries to deal with the outbreak.
It's very difficult for us to watch this happen and not respond. In medical school, we teach clinicians to go towards patients. Our medical school is now going to go towards Liberia and do everything we can to help stem the tide of this most challenging disease.
I want you to be able to say that day that I did try to feed the hungry. I want you to say that I tried to love and serve humanity. That I just want to leave a committed life behind. If I can show somebody he's traveling wrong, then my living will not be in vain.